My name's Kartik Logishetty. I'm a consultant hip surgeon. Well, I've always been fascinated by how science and engineering can be applied to medicine, and the hip is a perfect example of that. I think early on in my medical training, I was very much enamored by human anatomy, by mechanics, and by just generally building things. And in my spare time, I'd be building stuff and tinkering with things. So that seemingly naturally applied to hip surgery because in training, I saw how much of a difference surgery can make to people. Patients who were struggling to walk or get on with what they loved doing, then returning to active, independent lives. Alongside that, I was lucky that I had the chance to train with some greats of hip surgery in and around London and around the world. And they were in their own way very inspiring to me in their journey, their stories, how they thought about problems. And I had a chance to train and then research with them as well at centers like here at UCL, Imperial, in Ottawa, in Canada, in New York, and in Switzerland. So there I was able to explore new techniques, new technologies, and implant design as well. So becoming a consultant, that allowed me to put everything together, the surgical part of things, the innovation, and the ability to make a direct impact on patients' quality of life. For me, the most rewarding part of the job is definitely the patient journey, and seeing that patient initially in that first consultation, um, their problems, their stiffness, their pain, affecting their quality of life, and then seeing the patients regain that freedom that they thought sometimes they'd lost, whether it's walking without pain or getting back to work or sport or simply enjoying time with their families again. So each case is unique. So whether it's preserving a hip rather than replacing or resurfacing it, and that might be something like an osteotomy or keyhole hip surgery called hip arthroscopy, or actually replacing or resurfacing a hip joint because of arthritis, they're all very satisfying, very rewarding things, both as a surgeon and I think regularly as a patient as well. And the common thread here is that these are operations that work and they help people get back to their lives. I also find it deeply fulfilling to contribute to the future of surgery through training surgeons and leading research as well on various new technologies at UCL and collaborating internationally and sharing that. So that's very rewarding to me personally about the job. So knowing that I can have an impact to the patient and also more broadly to the orthopedic community, that's particularly enjoyable for me. The number one, I think patients can expect to be heard and understood. I think when someone comes to see me, I definitely take the time to listen to their story, to how they've got to the point of speaking to an orthopedic surgeon, which is quite far down the track, and it should be. I expect to go through their images very carefully, organize specialist scans, and then explain to patients in a very clear way what my opinion is, what my professional understanding of their problem would be in a very clear and honest way. So it's never really just about whether an operation is the answer or what practically can be done, but it's also about exploring whether it's the right choice for that individual at the right time in their lives. And at the very start of that conversation, ensuring that all other options except for surgery have been exhausted before going down that route. So I make sure we discuss all the options, of course, and then we can make a plan together. And I think specific to my practice is that we might organize for specialist scans, 3D planning, and often a multidisciplinary approach as well to hip care. And finally, I think patients can expect a partnership with the surgeon, with the whole team. So I can bring the surgical expertise, but I think the patient brings the values and the priorities, and the decision to go ahead with surgery is certainly theirs.